SSG purpose, and we are a nonprofit foundation for senior services to provide older adults and their loved ones with education, valuable resources, and quality services to help seniors preserve their independence and improve their overall well-being, and to support and advocate for seniors in need to help ensure that all seniors are well cared for and can age with dignity without consideration of social, economic, and cultural status.
Abby, we have a couple of new people. Why don't you explain what SSG stands for?
Okay, I'm going to let you explain it while I look for more people to admit. I think I've got more people.
All righty then. I know we use a lot of initials here, and I just think sometimes it's helpful. We forget about how people might be new to it, but
right.
SSG is how the foundation provides services for the members or the people that are calling or interested. It's called the Senior Specialist Group, and we're a group of vetted senior. We work with seniors in our industries, a vetted group of professionals that support our areas. Our chapter is the South Bay chapter. We go as far as Long Beach to Marina del Rey, I believe, and inside to, I guess, Carson area, somewhere around there. No, Carson is to the right. But anyway, we're happy to work with anyone in this neighborhood. And then we find people that can support the needs of the seniors in our area.
All right. So today, as I said, we really felt like this driving topic was an important one to get out there. So the speaker we got from Providence Little Company of Mary in the San Pedro facility there. Purnima is an occupational therapist and certified driving rehab specialist. Since 2011, she has been working at Providence Little Company of Mary, working with clients with acquired brain injury. She has launched driving programs at various hospitals and has her own practice providing driving assessment services. And Theresa Thompson was able to join us today too. So we actually have somebody from the DMV, we're very honored to have her here. She currently serves as the driver safety manager, working as the senior driver ombudsman for LA and Central Coast counties. And she partners with senior organizations like ours to bring DMV information to mature drivers and assist drivers who have been referred to the driver safety branch of the DMV. So from our chapter today, I'm Abby Waddell. I am a senior real estate specialist, and I work with older clients all over the place to make decisions about transitions that they might need on housing. Jill Love, who is also in our chapter, she's a geriatric care manager with Peters and Love, and she'll be providing a couple tips since she works with many clients who have had driving issues as well. And then Grace St. Clair, who is an attorney, and she's the head of our chapter. She is an estate planning attorney. So we'll move on, and Purnima will head us off with Stay Behind the Wheel as long as you can.
Thank you. Thank you all. First of all, Jill, Abby, Grace, everyone, thank you for inviting us to do this presentation. And thanks to all of you who are participating in this presentation. And, I'm so passionate about this topic that, any opportunity I get, I just want to be able to do this so that, I can clear some of the misconceptions that we have. Because a lot of times when patients are coming or clients are being referred to me, they think I'm the DMV person. Sorry, Theresa, nothing against DMV, but what they feel is that I'm going to be doing a pass or a fail. So I'm going to clarify some of those misconceptions and make it easy on all our clients or all the family members who are facing this challenging issue of driving. We all want to stay independent as long as we can. We don't want to give up the keys. But we all should know one thing, that California we are fortunate to be here. We do not have the age limit where we can renew a license. The oldest person that I have done a driving assessment has been 98, and he also got his license he just came to me. He says, I just want to check out because he was being tested by the DMV. So he wanted to do like a refresher course. And he came to us with no specific diagnosis or any particular condition, but just wanted to see if he was, fit to continue to drive. And he did get his license, renewed. So it's not the age that matters. It's the impaired function. And we'll talk a little bit about what those impaired function could means. And that could be the limiting factor. Even I've seen people in their 30s or 40s have so many challenges because due to the medical condition or things have changed a little bit. So let's move on. Next one, please. So just giving a little bit information about, what are the facts, why are we talking a lot about the older drivers? It's the fastest growing segment of our population here, and we are living longer than we used to. And why it has become such a huge issue, I'm sure some of you may know the Santa Monica accident. The person, Mr. Robert Weller, he had history of, accidents, fender benders, but nobody attended to that. None of the doctors or the family members were scared to talk about the driving issue. And he ran through the Santa Monica farmers market, killing 9 people and injuring numerous people. So that caused that national attention. And that's why it became a huge, goal for the National Highway Safety to address the older driver safety. So we are all facing this complex problems. We want to make sure that we continue to drive safely till we, till we live, hopefully. But that at what time we need to reassess, okay, am I changing? What is changing here that we need to make that decision of giving up driving? Thank you. Next, please. So this is the picture of the Santa Monica accident that caused that national attention. And, I got my certification in driving rehab in 2006. But at that time, I was, most of the patients or the clients that I used to see that were all related to the traumatic brain injury, stroke, or other conditions, Parkinson's. But the older driver safety became a huge issue since 2009 and 10. And there was a committee formed within the driver safety office. Senior ombudsman came in place, and Theresa can talk a little bit more about it. But this is where it started the conversation about the older driver safety. Next one, please. So think about it, as we age, things change, and driving is such a complex task that it's putting so many demands on us. And how we become slower with the movement, slower, it also affects our thinking skills or our thinking processes. Our vision is changing. And we will talk a little bit about each component as we move along. But why do we think that, and a lot of our seniors or a lot of my clients that come to me, they've already made changes the way they drive or the way they used to drive. So it's not clear, black and white here, that everybody experiences the same changes or challenges as they're aging. But things are changing, and how we change our driving habits along with that, we are going to focus a little bit on that, so that it's not like, okay, it's not like you cannot continue to drive, or can we continue to drive within our neighborhood? We'll discuss more about that. Next, please.
Yeah.
So what are the functional abilities? What do we need to continue to drive safely? Of course, vision is the first important one. Vision, and we'll talk in detail about the vision part. The cognition, and what does cognition mean? It's about basically your thinking skills. Thinking skills are, that is the most challenging part, which it's a hidden challenge, which people sometimes are not able to figure out what is changing and why it is becoming more challenging with the driving. And then the motor function, that means, it could be anything, your tightness, your arthritis, your limited motion in your neck, or, having difficulty handling, multiple things at the same time, having some adaptive equipment, using a walker or a cane, that could be making changes. And I, personally tell everybody, motor function, that means your challenges that are physically impairing, those are the least of the problems that we can think of, but we need to make sure that we are addressing the vision and the cognition and how we can keep up with that. So let's talk about that. So why is vision so critical? Remember, vision is, 80% of our brain has vision channels, going from the back of the head to the front. There's constantly back and forth information. If it is working well, if our vision is working extremely well, we really do better in all aspects, because that is our gateway. How we, I'm sorry, somebody? Okay, so if there is any dysfunction in the vision, if any little change, it interferes with our performance and it affects our driving performance. So let's go and talk about what are the different vision conditions that can be affected. Next one, please. We know as simple as cataracts, people have, as we age, cataracts is one of the things that most of us are experiencing. People have cataract surgery, they get the lens implant, and things can be resolved with the vision part, because what happens is that at night the glare is bothering us. And then there are conditions like glaucoma. It's I'll show you the picture as we move along, and then the macular degeneration, and then the diabetic retinopathy is very common with patients who have, or clients who have diabetes, and they experience patchy vision, and that could be a fluctuating vision. It's just not, sometimes their vision may be okay, they may be seeing things clearly, but if the blood sugar levels are changing, that can affect their vision. It can get blurry. So getting a good eye exam every year, every 6 months, depending on what your conditions are. Please, I encourage a lot of my clients, to get a good eye exam at least every 6 months if you have a condition. The glaucoma is the eye pressure, it affects the peripheral vision, and you can see the pictures as we move along. Next one, please. So think about the cataracts. This is on the left side of your screen. You can see that the normal vision, the incoming light is to get a clear picture. But with cataracts, the light is scattered and it becomes hazy, and there's like an opaque film on the lens of the eye, and that can make the vision very blurry, and it misses, and then we miss the clarity of the vision. The next one, please, is the glaucoma. How does the glaucoma affect? It affects the peripheral of the eye. The peripheral vision of the eye. So, in the early stages, it's because the optic nerve is being damaged, or it is getting affected because of the condition. And people experience loss of vision in one area. It could be on the top part of the right eye, or the left eye, or the bottom. And that's how it starts, with the peripheral vision being, constricted. And then, of course, it can encroach the central vision. But usually when somebody has glaucoma, they go to the DMV, they do a vision test. It can be missed because, the central vision is pretty clear, and they can see or read the chart pretty well. And they can, sometimes be missed at the DMV, office, and they cannot, but of course, with the advanced condition, it can change. Next one, please. This is the vision with the age-related macular degeneration. And what does that do is that it affects the central vision. So it's the detailed part, it affects the reading, it affects how you see things on the computer, because there's a little patch or a black spot in the central part, and any near task that you do, that can get affected. What that means is that, many times the patient have to move their head or to move their eyes to be able to see things clearly, because there are certain areas of the eye or the retina or the macula, you can call, that have clear vision, and they can move their head and eye, and they can see things clearly. But with lot of advancement, I mean, in the condition or in the disease process, that central part can get enlarged. I mean, they get bigger and bigger, and it affects their daily activities. Even like, taking reading their medications bottles, that can be affected. And think about it, how it affects the driving. When your central part, you could be missing the signal lights, the traffic lights. You may be missing the traffic signs. I've seen patients who miss signs for no left turn. There's on the top, there is a light with the sign says no left turn, and patients still just not see it, and they miss it. Next one, please. So what do we need really from visual perspective? What do we need for continue to drive safely? We need the near and the far vision. We need to be able to read our speedometer. So that's our near vision. And the far vision, we should be able to read signs. We should be able to see the traffic lights and traffic signs. And then we need a depth perception. What is that? How close you parked, you stop at the, excuse me, how close you stop at the light, behind a car. That requires depth perception. How do you put your car in a parking space? That is the visual spatial scale, in a parking spot, parking between two cars. How you position your, the lane positioning. Many times, if somebody has experienced a loss of peripheral vision or vision on the outside of their eye, or visual field cut, they are missing one part of the eye. The challenges that the person experiences is the lane positioning. They drift to one side. They're getting too close to the right side or the left side. And, if you're cognitively able to correct it, or thinking wise, you're able to correct it, then you can pull. You hear in a lot of time, patients or my clients don't pay attention that they're going over the lane dividers, and they fail to correct their lane position. And that's where we are the challenges. The challenges I also see is during left-hand turns. They are missing part of the vision, and they're going over the median lane, the yellow lines, and they cross over and go on the opposite side of the road. So those are the challenges when there are changes in their peripheral vision or the visual spatial skills, or they are not able to look around, they're not able to pay attention. Now, a lot of time, what is visual attention? It's very challenging, or it is difficult to discriminate whether you're visually attending it or cognitively attending it. It's hard to discriminate that. But visual attention is basically you're searching, you're paying attention. Think about it. You are at a traffic light. You're paying attention to the red light, but you're still paying attention to the cross traffic, if there are any pedestrians. If you're making a left-hand turn at an uncontrolled intersection, what that means is there is no left arrow, but you are going to make that left-hand turn. So you have to watch the light, you have to watch the oncoming traffic, you have to watch for any pedestrians in the crosswalk. So there's so much involved, and all that is a complex task. So thinking wise, visually, they all have to work together to accomplish that task. Next one, please. So this is, in a lot of times, people have fluctuating vision, and especially they experience the fatigue. When someone has any changes in their visual input, that means they can't see things clearly, or they have a visual field cut, and that can be affected due to either stroke or brain injury or other medical condition. They have loss of vision in one eye. Then there is, recently I have a client actually right now at the hospital working with, recently had a loss of vision in one eye. So the brain needs time to adjust to the monovision. That means, seeing with one eye. The depth perception we talked about, we need two eyes together to be able to do that. So that can cause a lot of fatigue. That means you get really tired because the job of our looking around with two eyes is being now just taken over by the one eye, which is the good eye or the healthy eye. So that can cause a lot of visual fatigue, and patients are constantly reporting that they get so tired. Think about it, our world is connected through our eyes, and if we are constantly struggling to keep up with that, it makes it really hard. So next one, please. So like we talked about, the hemianopsia is the word that is used for visual field cut, or somebody has field cut due to the stroke or brain injury. And a lot of times people even experience double vision when they're tired. And then we talk a little bit about the visual inattention. What's happening is that when we drive, especially with the aging, that visual inattention, that means, we are not able to pay attention to multiple things at the same time. And that's why, pedestrians are missed or the lights are missed. And the challenge comes even with the uncontrolled left-hand turns. I mean, a lot of my clients, they change their driving behaviors by just making, they don't want to do the uncontrolled left-hand turn. They go right, and they get to that destination by making those changes in their driving habits. And that's nothing wrong in it. It's okay to adapt to, and see what, makes it more challenging and how you can accommodate those changes or challenges by modifying your driving habits. Next one, please. So let's talk a little bit about the cognition, and that it means is the thinking. We all are present here attending to my presentation here, but think about it, the end product is the behavior. I'm not able to see what you're thinking. I mean, a lot of you may be thinking, I need to take care of this, or what my, next hour is going to be. So we cannot see what somebody's thinking. All we see when I'm doing a driving assessment, I see the end product, and that's the behavior, and that means how they're driving, their driving performance. If they're having challenges, many times I've done the paper pencil test and I see how their distraction is affecting them at our hospital. And then I see those same distraction affecting their driving performance. It's just difficult for them to be able to follow two-step instructions, or able to follow, let's say we are asking them to make a right at light, right turn, and then make a left turn at the next light. So they are just so focused on the driving that it is a challenge for them to pay attention. So, and that's why they miss it, or their end product the driving performance gets affected. Next one, please. So, like I mentioned earlier, behavior is the end product, but it is, how internally we are distracted, or how the external distraction affects, and that's how our performance comes across. So if you are, a lot of times I give this example, is when the clients are coming to me for a driving test, I tell them, the first thing I tell them, I'm not DMV, I don't do pass or fail. Because internally, if they're very anxious about this testing process, and I, typically would try to make them as comfortable as I can. And I tell them, think about it, that you're going to practice with us. It's a refresher thing. And you're getting an opportunity to see where you need to make changes. A lot of people, a lot of us, all of us do this rolling stops, those California stops. And how they are sometimes that internal distraction causes that anxiety, causes the result in having problems with their driving performance and they are so distracted externally also with everything that's coming at them. If there is a cognitive challenge, that means complex intersections. Think about it. You're paying attention to the oncoming car. You're paying attention to no left turn here, or it's a one-way street. The challenge that I've seen with most of my clients is just they focus what is right in front of them. That visual lead, or the lead that they need to have to see what is ahead of them, or what does this intersection looks like. That becomes a challenge, and then that is an external distraction that makes it really challenging for them to do. Again, I know we don't like to do multitask, but driving is a lot of multitasking, and it challenges us more when we have any medical condition that affects our thinking process. Next one, please. So what are the cognitive skills? I know jumping a little bit here. Attention is the foundation skill. If you cannot pay attention, you can miss a lot of things. Problem solving, a lot of times there's a construction zone. Think about it. A construction zone, we have to navigate through those workers, the cones, and that sometimes causes the distraction for us. Remembering, memory is another one, is that knowing what the signs mean, what these stop means. Many times patients even have those challenges, not remembering, understanding what the sign, and it could be a combination of their memory or their visual spatial skills. How they plan, how they, if they have to make a right-hand turn, how they are going to get into the right side, get into those broken lines, watch for the bicyclist, turn their head and make sure that they are not missing a pedestrian or a bicyclist coming from the right side when they make a right-hand turn. That judgment, with the oncoming car, when do you make that left turn? Trying to, judge the distance of the car from where you are and the speed of the oncoming car. So those are all combination of cognitive skills that we require. Next one, please. So a lot of these conditions, like a brain injury, which can, cause changes in their thinking, changes in their cognition or the thinking skills. Some of the neuromuscular diseases, Parkinson's, Huntington's disease, of course, different kinds of dementia, where it can be Alzheimer's or it can be vascular dementia. If you have experienced a cardiac episode or a cardiac arrest and you have had a history, there is a syncope, that means, you have fainted or you have loss of consciousness for a period of time, that can also affect the brain and it can affect the driving performance. And there are different mental health conditions. There's a huge tsunami, I would say, with mental health condition, with the pandemic. A lot of patients or the clients are experiencing changes with their thinking, and that is affecting, of course, their mental health, the depression, the anxiety. A lot of people stopped driving because of the pandemic, and getting back on the road has become a real challenge with a lot of our clients or our patients, with our senior population. And of course, then there are different health conditions like diabetes, sleep apnea. They're all conditions that can affect your driving performance or your thinking skills. Next, please. And this is the huge one. Many times the doctors are not discussing some of the impact that the medications can have on the driving. The combination of medications, it could be over the counter, but sometimes it's affecting, if somebody is taking a sleeping medication or sleep for their sleep, and if they're taking other medications for their conditions like for Parkinson's, and taking those medications are affecting their alertness, they are getting, drowsy, more drowsy. So, it's always good to discuss with the physician, why are some of these muscles, why are you experiencing severe drowsiness or decreased alertness while driving? So it's a very good discussion to have. Alcohol is another one. Some of the people are taking, muscle relaxants for their back pain. So all those combination of medications can affect your alertness, awareness, causing drowsiness, and can affect the driving performance. Next one, please. Fatigue is another one. People who are tired, they definitely need to consider that, of course, we all, at some point of time, we all get tired and we need to make changes in our driving times. A lot of our clients are coming to me and they say, they do not drive during rush hours, or they don't, if they feel sleepy, they pull over to the side and just take a little break, or especially long distance driving, it's affecting how you perform on the road. People might be honking at you. There are special, I recently saw a patient with ALS, that amyotrophic lateral sclerosis. So that's fatigue is such a huge factor for the person who has a medical condition. So think about it and think about conditions that can really affect your physical or cognitive fatigue. So thank you. Next one, please. Like I said, physical evaluation is the easiest one to handle. It's the easiest one to manage it. And we can have so many adaptive things available to make your driving safe. The range of motion. Sometimes, with aging comes the limited range of motion with our neck. And, I always demonstrate where the blind spots are, how far they need to look over the shoulder for changing lanes or making a turn, looking for the bicycle. I know DMV is, sorry, Theresa, again, DMV is not caught up with the technology. We have these backup cameras, but the DMV's requirement is that you have to look behind when you're backing up. So even if someone ending up taking a DMV test, you want to be prepared for those kinds of movements. Many times I do tell people that, if you have limitation in your neck motion, you can always move your body. You can turn all the way back and be able to see behind. If that is not a possibility, somebody with a neck surgery or a back surgery, there are special mirrors available, and we can introduce those mirrors to you during a driving test or a driving assessment. And we can help those clients with some adaptive mirrors to make that decision. Sensation is another one. People have neuropathy and people are missing, many times they have to make changes the way they drive. Hand controls many times I've recommended. The person has good vision, good cognition, or able to learn something that's new with the hand controls. I'm always promoting that, you can continue to drive, but now you'll have some adaptations in the car. We see a lot of patients with neuropathy and they are transitioning to hand controls, and that is a possibility. How your activity tolerance is, how your coordination is. People with Parkinson's, or sometimes it's not even Parkinson's, it's essential tremors that, people have hereditary, that means the hands are shaking, but how do they stabilize their steering wheel? And many times, they may have so many, when I do the paper pencil test, they have a hard time doing anything to do with the writing. But when I see them in the car, they are really good at managing the steering. They are able to stabilize it and not experiencing any jerky movements. So with Parkinson's or Huntington's disease, sometimes you can see some jerky movements, but that can also be that can also be addressed during the driving assessment. Next one, please. Going back a little bit on the hearing part, the reason hearing I've introduced is because, many times if there's an ambulance or a fire truck, if you have issues with your hearing, you may be missing that, and people don't pull over to the right or even stop where they are. Sometimes it's not possible to move over to the right. So you still need to be able to hear the sirens and it's coming from somewhere, knowing where it is and make that decision. So we talked about the poor sensation, and the other one is the falls. Many times people are experiencing a lot of falls at home, and that is a concern when it even comes to driving. So falls are one of the biggest reasons for our clients to be admitted to the nursing home, and becomes a challenge to get independent going back home safely. And because of that, they lose their driving privileges. So just in general, the flexibility and the strength, if they're decreased, you can get some therapy for that and get better with some of the skills that we can address and have a modification. Like, someone who has arthritis in the hand, cannot turn on the ignition. We have adaptations for adaptive keys for that. A seat belt, it's so important. People sometimes have to use a different kind of a pull, there's a belt available and you can have an adaptation for the seat belt. So things are available, and take advantage of that to keep your driving independence. Next one, please. So physical complaints are more related to the body aches and the pain. And then, being in one position is another challenge sometimes for people with back pain or hip pain. So moving, and during our assessment, sometimes I give patient a break time. They can get out of the car, move around for a few minutes, and those are the easiest ones to handle. Next one, please. So, we talk a little bit about, frequent breaks, establish a routine in your, exercise program, time management, give yourself extra time for mobility. If you're using any adaptive equipment like a walker or a cane, or some people even use wheelchairs or scooters, they can definitely have adaptations to hook up their scooters to their car, or sometimes, do they have the balance? I check that out too. If they're using a scooter or a walker, I see how they can load and
They're going to address how to take the keys away from them.
Sorry. How they can load and unload their wheelchairs, or I'm sorry, their walkers. They should have the balance to be able to move from the back of the car, back seat of the car, to the driver's seat. And that's how we can, I typically check that out. If the person comes alone to the driving assessment and they're using a walker, I make sure that I am assessing their ability to load and unload their walker. Thank you. Next one, please. So how do we know? What do we offer? And how do you know, am I safe to continue to drive? So there are two parts to the driving assessment: the clinical assessment and on the road assessment. So on the clinical, next one, please. So what am I doing during clinical? Oh, I'm sorry, going back here. What if somebody has to participate in a driving assessment? What do we need? We need a prescription from a doctor, from an MD, and with the diagnosis why the person needs to be referred. Recently I saw a patient because they had a right knee surgery. The patient was referred to see if the patient has the flexibility in the right knee or the strength to continue to use the gas and the brake pedal. And then, of course, someone needing a driving assessment, we make sure that they have a valid driver's license. And if they do not have a driver's license, we can get a permit. And Theresa will talk about it a little bit. It's a special instruction permit due to a lot of, many physicians report the clients to the to the DMV, and the patients are losing their driving privileges. That means that either driving gets suspended or revoked. And many times the patients are really upset about that the doctor took that step. Of course, the physicians that know me or they're familiar with our program, what they do is they refer to us for a driving assessment to see if the person has the potential to continue to drive, or they need to be, they eventually get reported, but going through different steps first before they get reported to the DMV. And, many times the suspension on the license happens, and then we are able to get a one-day permit, a special instruction permit. And DMV has been really helpful with that process. Theresa, thank you for that. With all the people at El Segundo office, Orange office, they know about our program, and they are able to give us for a one-day permit to do the assessment, and we can help them to do that process. Next one, please. So what the clinical...
Social service manager, and I'm away from my...
I'm sorry, I'm not able to hear that. So physical assessment, I know I check the sensation, coordination, and I do the vision screening. I also look for any cognitive challenges that person is experiencing. But just based on what I see on the clinical assessment, in my 20 plus years of doing driving assessments, only 3 people have not taken them on the road. Any person who comes to me, I do give them the opportunity to drive with us, getting in the car and see what their real driving looks like. Clinical assessment does give me a little idea about what their challenges are, but I always relate it to how their driving performance is. So, a lot of times I tell all my clients, does not matter how you perform, do your best, what you're doing on, in the clinical setting, or when I do the paper pencil test, but then we definitely rely on the on the road behind the wheel assessment. In combination, we try to give that fair, objective assessment to keep our clients safe on the road. Next one, please. So on the road assessment, that includes anything and everything. Like I already mentioned, how the person gets in and out of the car, if they're using any adaptive equipment, how they start the car, how do they approach the intersection, are they paying attention to
Disconnect, I take it off. It does.
And Abby, Jill, how is the timing wise? I can move on.
I think we need to, move a little faster, I think, but we're good. We
Sure.
can move quickly.
Yeah. So on the road, we look at the intersection. So what is my role as a certified driving specialist? I do the function behind the wheel assessment on the road. I help to if anybody needs an adaptive equipment, I help them to get that, or I help sometimes, say driving is not an option. The outcome is not to continue to drive. Then we help them to provide, some alternative transportation services. And we have a program, optimal aging program, patients, it is covered by Medicare. And it is, we help clients with those processes in the next, during our sessions. And I just want to say that the driving assessment is not covered by any medical insurances. It is a private pay, so patients have to pay out of pocket. Some of the insurance do cover part of the assessment as part of occupational therapy, but you have to manage that, or the family members sometimes approach their private insurances to get the reimbursement, part of the reimbursement. Medicare does not cover driving assessment. They don't think it is necessary. Yeah, next one, please. So what is I just want to wrap up with this is, what is critical? What is the outcome of this driving assessment? And what kind of recommendations do we make? First of all, we have to know the cause. Is it something, the condition is stable, it's happened, like a brain injury, traumatic brain injury, versus dementia, which is a progressive condition? Is it, we have to make sure that when we're making the recommendations, we come with a plan of what, if they need to be reassessed every 9 months, 12 months, depending. Again, the physician makes that decision whether the person needs to come back for a reassessment. So we definitely help clients to make that final decision and come up with a plan, share with the patient or the client and the family members, the referring doctors. And at times, if the person needs to be reported to the DMV, I help with that process too. I also help clients to make the decision if they want to self-report. DMV loves to hear that, the patient themselves telling the DMV, I have a condition and I have been evaluated at the Providence or a different hospital, or at a whole hospital also, I do the driving assessments. So, I definitely help with that process. And it makes it a lot easier for them to keep themselves safe for a longer period of time. The huge liability issue is also covered with that once they are self-reporting, or we are helping them to report to the DMV. Next one, please. So there are a lot of resources, American Occupational Therapy Association, next one, please. AARP has a program, Drive Sharp from AAA is also a program. They're all computer-based program, but it does not, of course, take you behind the wheel. But there are definitely, AAA is providing senior driving program. But if you have a medical condition, their scope is limited. So then, it's always a good idea to go through a clinical program which can help you to identify and make sure, because some of the patients that are coming or clients, they have done 20, 30 hours of training, but the changes, they are still not passing the DMV test. So there has to be, a clinical background with somebody who is able to perform our driving assessment. So physician's guide is also available. Talk to your physician and we can address that. Next one. Any questions? So driving is just not a privilege, it's a necessity, especially in California.
Yeah, so, and I think what we talked about too is saving, because we've got Theresa talking next from the DMV, we're going to save our questions and answers till after that. So anybody that has that, please write it down so you don't forget your questions, and we'll call on people at the end. So asking people to just mute themselves, and then we'll take whatever questions you have at the end.
Thank you all.
All right. Thank you, Purnima. All right. So we've got, and I'm not sure. Oh, this is okay. Theresa, this is the DMV first slide. So I can't even see who else is on here. Are you with us still, Theresa?
I am here, yes.
Awesome.
Ready?
Take it away.
Okay, good morning, everyone. Thanks for having me. Again, my name is Theresa Thompson. I'm with the California Department of Motor Vehicles as the Senior Driver Ombudsman. And Purnima did mention the Santa Monica incident, which kind of prompted our role within the Department of Motor Vehicles, so that seniors had a direct resource to reach out to if they're struggling or having issues with their driving. So I'm going to jump right in. First off, here in California, we don't have an age limit regarding driving. We don't say you have to stop driving at 105. You have to stop at 99. That's not our role. We do have driver's license requirements, though, for persons renewing their license at 70 or older. You will have to report in person to your local DMV when you're 70 and older upon renewal, okay? And you would submit to the vision and written test. And as it shows for our vision test, we're looking for 20/40 with both eyes, 20/40 in one eye, and at least 20/70 in the other eye. If anyone that comes in for this test and they fail, I'm sorry, I shouldn't say fail, they don't meet our vision guidelines, then we will give them what's called a report of vision exam to take to their physician regarding any conditions with their vision. It could be just as simple as they need glasses or a new prescription, or they may have cataract or, diabetic retinopathy, glaucoma. Those things would be addressed. And then once they bring it back, that form is reviewed to determine if they have to take an actual behind the wheel test. Because notice when you're 70 and older, you come into test, but only vision and written, no driving test. So the only time a drive test is required is if there's an issue with your vision during the renewal process. As far as the knowledge test or the written test, it is a 25 question test. It used to be 18. It was increased just this year, and you can miss 5, okay, on the test. Anything over 5, it's not a passing score. And you have 3 chances to take that written test. So when you pay for your application at the DMV, you get 3 chances to test. If you fail 3 times, then you start your application process over. You pay a new fee, you fill out a new application, you take another vision test, and then you get a set of 3 chances to take that written test. That's how it works. If everything is passed, during this process for a senior 70 and older, you're given a driver's license for 5 years. Right now, there's some special provisions in place due to COVID and probably some other things going on right now with our health in the nation. So they are offering seniors to renew online, waiving the vision and the written test requirements. So they're letting you renew online if you're eligible. You'll know that when you create your account and go into the DMV website to do that and start the process for renewal. If you're eligible, it'll allow you to go right through and pay your fee, no test, and they'll use the same photo, and then they will mail your license in 4 to 6 weeks. Next slide. So DMV also, as the licensing agency, has to monitor traffic safety regarding health and safety. And so there are physical and medical conditions that we may have that require regular visits to your doctor, follow-up visits, or just information from your doctor or pharmacist regarding your medications, because we all have to be responsible regarding what we're taking and the side effects from those medications. That's the important and the key. And working with your physician to stabilize any condition that you may be diagnosed with. We all know that we didn't ask for any condition that we may have, but acknowledging that there's something going on and that there's a treatment medical regimen in place is very important to follow so that you can remain healthy. And then, of course, if you're healthy, it shouldn't affect your driving. Excuse me. Also being responsible, again, I can't say it enough, for side effects for medications. When people think of DUI, driving under the influence, they normally think about alcohol, of course. And DUIs do not just deal with alcohol. It also deals with prescription medications as well as illegal drugs or holistic, anything over the counter. So if it makes you feel loopy, dizzy, or, whatever it is, you've taken 3 or 4 prescription medications and you go out and drive. If an officer observes you or the public observes you and calls you in because you're driving as you're impaired, I'm sorry, driving under the influence of anything can make it's the same as driving under the influence of alcohol. The weaving, the dozing off, all of those things can lead to having an issue out there on the road. So we have a driver safety branch that deals with that if you're referred to us, and we'll get to that in a moment. Next slide. So how does someone come to the department's attention? We have referrals. Doctors are mandated reporters. They must report conditions that may affect someone's driving, regardless of the person's age. I'm senior specific, but this information can be for a driver of any age, okay? So what I tell most of the people that call me, don't change your doctor. Doctors are mandated to report. They're not picking on you. They are making sure that they are being held accountable for what they were licensed to do. And that is to let DMV know that this person has a condition that may affect their driving. And then DMV has a process they will follow. They will reach out to you via mail. They will send you what's called a notice of re-examination, along with a driver medical evaluation that consists of 5 pages that must be completed by you and your physician. Okay, it's submitted back to the DMV timely to avoid a suspension for not complying. And then we will review that information and schedule you an appointment and talk with you in detail about your driving and any medications and the diagnosis. So that's how that works. Could it result in a suspension? Absolutely. It may result in a suspension. That suspension is usually indefinite. It just depends upon what's going on with that condition. Is it stable? Is it progressive? Sometimes, unfortunately, the DMV will have to step in and suspend the license for persons that have progressive conditions that are worsening and affecting their driving. Family and friends can report us to the DMV as well. They must identify themselves. DMV does not accept anonymous referrals. So if you're wondering, well, wow, that's not great because I want to report a loved one, but I don't want to be identified. We just can't accept anonymous because some people are malicious. However, there is a form to fill out. It's called Request for Regular Re-Examination of Driver. I know that's a mouthful. And then the form is DS, D for David, S Sam, 699. Easy to find on our website. If you go to dmv.ca.gov and you type in or search DS 699, the PDF of that form will pop up. You can type it, print it, do whatever you need to do. But there is a box on that form where you can check to be kept confidential. So we won't tell the person that you reported them, but it requires your information, your name, your signature, and a phone number. We may have to call and get just, a little bit more information. We may have to call to validate what you're reporting, okay? A self-referral, as Purnima mentioned, a driver can report themselves to the DMV. I have been recently diagnosed with Parkinson's or, multiple sclerosis or Alzheimer's, whatever the condition is. Or sometimes we will get information from our senior drivers and they'll say, my children are concerned about my driving. I want to make sure I'm safe. It may not be a condition per se. We'll deal with your skill. We may not always need to have a medical, but we may call you in and talk with you about your concerns about your driving and your family's concerns. Ask if you've had any recent fender benders or accidents, and then send you on an actual driving test. And then that's that person's, time to shine, to show us that my skill is still up to par. I'm demonstrating that I can drive safely, or unfortunately, maybe the skill level has deteriorated. Maybe they want to take some lessons and try it again. So there's several different options to keep you driving for as long as you can do so safely. I don't know why DMV has such a bad reputation, okay? Because there are a lot of things out there available. And then law enforcement. There's a notice of re-examination that any officer can issue to a driver if they observe their driving and they feel it's unsafe. They can be called to a traffic collision. They can actually observe the driving. And a lot of times with our seniors, which they are actually the safest group of drivers, they have their faults as well. You know, driving with a law enforcement officer behind you with lights and sirens activated, not pulling over because they feel like they haven't done anything wrong. Well, that's not appropriate. You pull to the right and stop. You cross your fingers. If they go past you, then you're good to go. If they stop and approach you, then you can talk to the officer and figure out why you're being stopped. So those are things that a lot of my seniors are pulled over for, and also experiencing side effects from those medications, dozing off, having an accident, while driving, which is not good for anyone. And that's how you are brought to the department's attention. When you're brought to the department's attention, as I mentioned, there is a process, for driver safety to actually reach out, get more information regarding the condition that's being reported. You have an opportunity to have an administrative contact, whether it's a re-examination where we're investigating, or a hearing, meaning that we've taken an action and now we're talking with you about why the action was taken, what was used to take the action, and then the driver has an opportunity to present evidence. Maybe that's more medical information that's now favorable. Maybe they're diabetic and they did have an episode, but now it's controlled and they're presenting more favorable evidence where the DMV can consider that, give them testing if necessary, and reinstate the driving privilege. So it's usually never the thing of you just can't have your license ever again. We don't normally operate like that unless, of course, there is a condition that's progressive. Alzheimer's, dementia comes to mind, of course, because at some point in the later stages of that condition or those conditions, we're unable to license. We're just unable to uphold having the person drive anymore. I want to just talk a little bit about my seniors as far as they restrict their own driving. Self-restrictions, self-imposed restrictions are lovely. It's not a bad thing. It does not indicate that you're not a safe driver. It indicates you're being very responsible and reasonable. You acknowledge there's an issue. I don't see well at night. I don't like to drive at night. There's nothing in the vehicle code that says you have to drive at night. You have to drive the freeway. The expectation is if you drive at night or on the freeway or during inclement weather conditions, you're able to do that safely. But if you know that you don't see well at night, doesn't mean you can't drive perfectly well in the daytime. Okay. And we have no problem with that. Self-imposed restrictions are lovely. Most of our seniors are doing that on their own. It just comes a time where if they come to the department's attention for whatever reason, and we have to impose a restriction, they don't like it. They may say, oh, I haven't driven the freeway in 35 years on their own. But if we say, we're going to put that on your record, you can't drive the freeway. Oh no, I may have an emergency. Well, if it's been 35 years that you haven't driven the freeway, you probably are not going to drive the freeway. So sometimes it's just, our position is safety, of course, and sometimes that gets in the way of independence. And we do our best to keep you independent. But as the licensing agency, we have a responsibility to traffic safety. And we have to, keep that in mind. Next slide. So for some of us that are no longer driving, which is perfectly fine, the DMV offers something free. If you are 62 and older, you can get a senior ID card. It's absolutely free. It's valid for 8 years, 8 birthdays. And you can also get that as a real ID identification card. And we're going to talk about real ID in a moment. We don't give away much free at the DMV. But if that's something that you're interested in, you're no longer driving, and you're going to now still need a valid government ID, which is usually something that's required for different business transactions, I would definitely suggest getting a senior ID card. It's not hard to do, it's free, and it's something that'll be an easy transition from having a license and going into your ID card. Okay, next slide. So Real ID, that's a hot topic. Real ID is a federally compliant driver's license or identification card. It will be effective May 3rd of 2023, so about 8 months from now. It is required to have an in-person visit to get a Real ID, driver's license, or identification card. Let me start by saying it is not a separate card. As you can see on the slide, Real ID is identified by having that very gold bright bear with the star on the top right corner. So if you're wondering during this time, do I have a real ID, driver's license or ID? And you take it out. If it doesn't have that bright gold bear on the top right corner, it is not a real ID, driver's license or identification card. It requires you to come in person to the Department of Motor Vehicles for this federal process, and you have to bring specific documents. We need an identity document, just one identity document. I just listed here the most common. These have to be originals or certified copies, no photocopies. So a birth certificate, a valid US passport or passport card, so unexpired, and a certificate of naturalization or citizenship. Those are just a few documents. We have a list of documents that are for the identity document on our website. Of course, you can always contact me if you need more information. Social Security verification is required, so your Social Security number must be on the application. And then proof of California residency, 2 pieces of official mail. What's official mail? Something like utility bills, which includes a cell phone, your vehicle or boat registration, the title or mortgage, rental agreement with your signature as well as the owner. Anything from your healthcare provider, not a card, but some mail from your healthcare provider, or bank statements, financial institution, something of that is required for the identity document. Okay, next slide. If you choose not to get the real ID, which is not mandatory for you to do through the DMV, you will have a driver's license or ID, and by the photo you see in the top right corner, it does not have a bear. It says federal limits apply, okay? Let's talk a little bit about what does that mean. So Real ID is a federal program. Because of the events of 9/11, Congress wanted to have something for all states more safe with their motor vehicles issuing driver's license and identification, since they're government IDs. And so that's why you have to come in person and you have to bring all of this official information to verify you are who you say you are, and we have your correct name and social security number. So Real ID on May 3rd of 2023 is required if you're boarding a plane. So you're going to go through TSA, that's federal, or if you're going to be entering secure federal facilities. That's what Real ID is for. If you choose not to get a Real ID, because you don't have to, but you still want to travel, as long as you have a valid US passport, you can use your passport, no problem. Okay, so if this person here with this current photo that indicates federal limits apply, then that indicates that that person will not be able to use that ID or driver's license on May 3rd of 2023 to go through the airport. They're going to need additional ID verification. So maybe their passport or whatever else TSA will accept. Okay. And then we'll go ahead and move on. So we're here. Disabled persons placards. We want to talk about that. So an issue of a placard is determined by your physician, surgeon, chiropractor, optometrist, physician's assistant, nurse practitioner, or certified midwife, not DMV. We have a bad rap, but we are not doctors at DMV, so we are not allowed to say, yes, you get a placard or you qualify or you don't. That is from your physician, okay? New or replacement placards can now be ordered online. A lot of services are available online because of COVID. Next slide. Okay, so the qualifications for disabled persons placards or plates. Loss of use of one or more lower extremities or both hands, diagnosed with a disease that substantially impairs or interferes with mobility, unable to move without aid of an assistive device, and specific documented visual problems, lower vision or partial sightedness. These are the qualifications to get a disabled person's placard or plate. There's an application, again, that your physician will fill out regarding this. Once the DMV gets this information, the doctor is responsible for completing the section regarding the criteria, and if you meet that criteria for a permanent placard, which is the blue placard. Next slide. Okay, can I share my placard or plates? No. The placard is issued to one person. That one person is the person whom the doctor certified has a permanent disability. So you cannot lend your placard to another person. You cannot be at home and not feel well and give your placard to your caretaker or your family member to go park in a spot to go get your medication. It doesn't work that way. It has to be used by the person it's issued to. When you receive your placard, you will get what's called an identification card. It looks a lot like a vehicle registration paper, okay? And on that, it identifies the placard number as well as you as the placard owner. That should be carried with you whenever that placard is used. A lot of people throw that piece of paper away. They think it's a receipt. It actually is something that is issued for identification purposes for the owner of the placard. So I would say make a suggestion to maybe make a photocopy, which is acceptable, keep in your wallet so that if you're not in your vehicle, you always have that paper with you. And you do need to show that if it's requested by parking enforcement or law enforcement, okay? Next slide. So as far as our service options and resources, you can contact our general DMV number at 800-777-0133. Our website is very interactive now. You can ask questions. The one good thing from COVID, if that's allowed to be stated, is that it has made DMV move very fast on offering services now available online that does not require you to come into the office. Which is a good thing because, you know, it's not fair to have an agency that where you have to go take your business and it takes an entire day. So now, you know, we have been forced to upgrade our technology, which is good, so that we can accommodate our customers. We also have kiosks in local grocery stores and DMV offices where you can do your registration. This year, I wanted to try it. So I went to my local neighborhood grocery store, I shopped, and then at the end of that, I went to the kiosk and I bought my registration. And so I wanted to make sure I kind of tried it for myself to see how it works. It was pretty simple, very expensive, but pretty simple. You have the Senior Driver Ombudsman outreach team to contact if you have questions. I listed myself because I'm LA County and Central Coast counties. We have an ombudsman in the Central Valley Inland Empire area, as well as Sacramento and Northern counties. Okay. I wanted to make that quick so that we can have questions and answers. And I think I am all done now. Thank you. Thank you so much.
Thank you so much, Theresa. We really appreciate your expertise and sharing all of that really, really helpful and practical information. And my name is Jill Love, and I'm one of the fellow SSG South Bay chapter members, and I'm a geriatric care manager. I'm also going to keep things short so that we have some time for questions, but I know that one of the biggest questions that comes up for families is how to start the conversation when it comes to questioning or determining whether or not a loved one is still safe to drive. And hopefully a lot of your questions got answered through Purnima as well as Theresa about resources that are available to you. But just in terms of opening up that conversation, my guidance to clients and to families that I work with is for the loved ones to really document your observations and specific concerns that you have. And this can be a group effort. So if you have multiple family members or even close family friends, people who interact with your loved one regularly and have noticed some concerns or declines, getting their observations, so it's not just coming from you, might be helpful. But as Purnima and Theresa have mentioned, there could be a variety of reasons why you have concerns, and hopefully there won't be shame or embarrassment surrounding this type of conversation, but really making it very objective and just realizing that circumstances have changed and that maybe taking a closer look at the driving privilege or necessity would be helpful. So document your concerns, identify them specifically, and then try to figure out who's the best person to launch this conversation. If maybe it's a sibling of yours, or maybe it is a friend where they can talk about it peer to peer rather than daughter to mother or daughter to son. So also picking the right time of day would be good, where you don't feel rushed or where you don't feel like your mom or dad is going to be stressed out. All of those things will help improve your chances of having a positive conversation. And then maybe start by asking them, how do they feel about their driving? And maybe bring up, a recent diagnosis or some new medications that you've already been talking about. Hopefully this doesn't come out of left field for them, but you're just continuing a conversation that you've already been having about their general health and well-being. So you already have some context in place. And then after they've talked about, hopefully they've self-identified some of those concerns, just as Purnima and Theresa have mentioned. And then you can build off of those mentioned concerns and maybe add some additional concerns that they may not have talked about, or maybe they haven't even noticed them themselves. And then if you have permission from those family friends or loved ones to use their names or to use an example of an observation that they noticed, then it again helps build your credibility and helps build the case. And then ask them about their status of their registration, their insurance. Hey, when is your driver's license up for renewal? Maybe getting some behind the wheel lessons or something like that will be helpful to help you feel confident, or to help you know where are some areas that you really need to focus on. And having a perspective of really wanting to preserve your loved one's driving independence will be a lot more beneficial than coming with the perspective that you want to take those car keys away right away. Give them the opportunity to go through these programs and then go from there and see what somebody like Purnima might have to say, or how they fare on that DMV exam. And then if you need to, then you can start discussing alternatives to driving. So that's the next slide. It would be really, really difficult to take something like driving privileges away without replacing it with practical logistical alternatives. So what I've found is that family and friends are by far the most common next step, is that somebody steps in to allow their loved one to retire from driving. But then also next most common, if there's financial opportunity, hiring a professional caregiver or companion who has already gone through a background check, has been DUI checked with the DMV and with the DOJ. All of those things give a lot of peace of mind that your loved one isn't burdening their children or their friends, and they have somebody who is dedicated to helping them at that time. Church or village volunteers might be a great alternative as well. And then there are city or county-wide transportation services that you might want to look into, depending on which county your loved one resides in. And then also, thanks again to the pandemic, we have a lot of services that have moved to delivery. So getting weekly groceries delivered to your loved one, or having a manicurist come in so that she can still get her nails done, or a Medicare approved podiatrist can come in, and that's part of insurance coverage already. So there are a lot of creative solutions that hopefully you can work together as a team and build on these conversations. It won't be just a one-time conversation, but working in a trusting and loving way hopefully will help you to make some good progress with your family. And Grace, go ahead.
Great. Now, the problem is, what do you do with the car if you decide to not drive it anymore? You have to be very, very careful. The car is the hardest thing to do something with, ironically enough. The DMV has very interesting rules about cars. Make sure you don't just give it away to somebody. You have to transfer the title. That's the most important thing to think about. And then I suppose if you're going to allow someone to drive it too, they must have a specific license in order to drive it in between times. That's very, very important. So be careful that you're not putting yourself in jeopardy with someone else getting into an accident or stealing it or doing something without your permission. So those are the only things I wanted to say. One thing I've noticed, just to start the conversation rolling, is when you're in your car by yourself, it's often easier to be hypnotized by your driving skills. And I think sometimes having someone with you makes it easier to drive. I've noticed too also that the radio commercials now allow noises and sirens in them. They never used to allow that. So that's a very interesting problem now with distracted driving. So